Welcome to Ageless by Rescu. This podcast is devoted to exploring the science of rejuvenation, uncovering the most trusted experts, the must-have products, innovations, and technology in the field of vitality, aesthetics, new beauty, and cosmetic enhancement. Dr. Fadi, this is the best conversation to be having. Do you know what? I've learnt so much about dentistry in researching for this episode. We're talking all-on-4 implant. I had no idea this universe of dentistry existed.
Yeah, it's a whole level of services in dentistry. So just to clarify, all-on-4 was the actual concept brand name of the original process, where they used 4 implants basically on a fixed bridge to provide a solution. So you can imagine 4 implants splintered together can provide, at least up to 12 teeth. And since then, all-on-4 has developed more into also an all-on-X. So sometimes we put 4, we put 5, sometimes 6, and there's variables on that. But the concept itself started off as all-on-4 and people refer to it, but really it's more now all-on-X or all-on whatever's needed to provide that solution. And we'll go through that during the interview.
So the reason I became really fascinated, and I invited you to have this conversation for our listeners and viewers, is that dentistry and cosmetic dentistry and reconstructive dentistry is very much part of that conversation of restoring youth and structure and beauty back to a face. And if we forget this key part of our face, in fact, the central focus of our face is not necessarily the eyes, it's actually the mouth. That's where we're alive. We're really missing an important opportunity for beautification, restoration, and also the health and structure of our anatomy. So when I learned about all-on-4, what I understood, and again, I'd love the clarification as we go along for kind of my layperson's understanding, is that so cosmetic dentistry will do veneers and caps and whitening and smile restoration, but we are talking about bone restoration here. We're talking about fundamentally rebuilding where teeth may be lost, irreparably damaged, gums receded. Am I correct?
Yeah, that's right. So cosmetic dentistry is the umbrella. So where this falls under, it can also fall under cosmetic dentistry. It's more aesthetic or cosmetic reconstructive dentistry. So like you said, cosmetic dentistry, we know it as whitening, veneers, bonding, crowns if necessary, and we try and reconstruct those as aesthetically as possible. There's many techniques. I'm an expert in the field of digital smile design. I use that. I speak a lot about that. So where this falls is, this is pretty much a lateral shift in that area, except you're applying all the principles of cosmetic dentistry, except you're using techniques to replace the lost teeth and also the lost bone. And there's many ways to do that. In particular, the all-on-4 technique allows the bridge work to restore the white aesthetics and the pink aesthetics. And shaping of the pink aesthetics is how we can reconstruct the areas of lost bony support, which obviously affect the face. And like you said, the most significant cause of aging in the face is the lower facial third, and this is our domain. And when you lose a dentition, or you've got what they call a terminal dentition, you're in serious trouble in that department, because you basically are losing total support in that area, and hence the significant collapse. This is why this procedure is so significant and is so important and amazing, in what can achieve if done correctly in such a short period of time.
Dr. Fadi, what I'm really interested in is what you touched on, which was the pink and the white. So the pink, I understand, is being the gum and the bone, and then the white being the teeth. Now, when you think about dentures, traditionally you think about senior, kind of like really old, and where the teeth may have naturally deteriorated as part of age or a disease or whatever. But the work that you've shown me, and I love coming to, well, first of all, you're my dentist, but I love it when you show me some of the work that you've done. And the thing that made me so super interested in this topic is that you're working on people as young as in their 30s or in their 20s if they've had an accident or injury. So denture technology and what we're talking about, the rebuilding of the bone, rebuilding of the smile, rebuilding of the arch, it's not dentures as we know it. It's not something that, it's a senior citizen problem. It is a medical issue or an aesthetic issue that you work with.
Yeah, well, there's many causes, and we generally attribute a complete edentulosum or a complete loss of teeth with the elderly, and that is vastly true. But there's many reasons why people lose teeth. So it could be genetic predisposition to extensive gum disease, and that could hit patients very early. So that's a cause of complete terminal dentition. There could be some social reasons and dietary reasons behind losing teeth to complete decay. And teeth sometimes get to the point where you just can't fix them. And, you end up having to have a mouthful of root canals, crowns, and so forth. And sometimes that might not be feasible or even, in fact, possible. And someone, could be as young as 20, 28, 25, being in that position. And then, we try and save the teeth as much as possible. But that could be a reason where we have to look at full arch implants as a solution. Again, that is the last option. But, we have to address these. And we're seeing a lot of this at the moment for many reasons, from dietary, social, drug use. There's many reasons why young patients get to that point as well.
So, and then the second thing that you said, which I think is really fascinating about this technology, and I guess very attractive about this technology, is that it's fast. So it's a surgical, procedure, and
Yes, that's right.
so there's a lot of pre-work in getting it right, and it's a completely customized solution. So it's not the dentures of old where you see the movies or cartoons where it's mouthful of teeth that you click in and click out. This is artistry, like fine art. And I've met the person who does your porcelains and your color matching and stuff. And I had a crown that that I had a couple of years ago. And honestly, I don't know how many art sessions I attended to make sure that, the veneer work was perfect. So I can only imagine that with dentures, that level of prep before you have the surgical procedure is wild.
Yeah, yeah, that's definitely the case.
I had one
So
tooth done. That was like that was Leonardo da Vinci stuff.
yeah, you can imagine. So we have technicians that are very specialized for each of these procedures. The ceramicist that you were dealing with is a specialist in crowns and veneers. So in this particular procedure for all on four, what we call the fixed bridges, think of it as a fixed denture, but it's not a denture. So that's what we're doing. We're fixing those bridges in the mouth using implants. So the prep work is significant because the better you prepare, the better the result. And what makes it significantly different these days is digital dentistry. So the ability to do your digital designs prior, assess what is the ideal position, work out exactly. You create a blank canvas, knowing that because we're working on restoring the complete dentition and taking everything off because it's terminal, you've got a blank canvas. So you can place the teeth in the ideal position, and understanding where the ideal position is helps, being an aesthetic dentist. And then I implement that into the surgical protocol and hence the final teeth. That's why those cases I showed you look so amazing, because everything is facially driven. Everything is designed specifically for that patient's face, for their anatomy, for their lips, for their smile line, for their face shape. So we pick sizing of the jaws and so forth. That's why those cases look so beautiful, because there's a serious design element that's gone into them.
And so when that's the pre-work. So
Mhm.
can you kind of take us through what the procedure would be? Because again, I'm pretty sure most people haven't heard of anything to do with this. You know, we've got a level of familiarity with things like Invisalign, or we've got a level of
Mm.
familiarity with smile restoration, but this is
Yeah.
deep.
Yeah, this is on a different level. There's slight variations. The protocol we follow is is pretty much the most current concept and the most seamless. So we would do, like you said, the smile design, the prep work, take all the records, and it's videos, photographs, 3D scanning of the mouth, understanding where the final bite would be, because you're working with teeth that are collapsed, so we're not going to use the same collapsed position. So we design in a new ideal position. So all of that prep work takes a couple of weeks. Then at the time of surgery, we've got all our data. So at the time of surgery, you extract the teeth, all the teeth most times that are terminal. You're cleaning, shaving the bone so that all the infected bone is removed, along with the infected gum. That's all done in our clinic or in our practice under general anaesthetic. And that often takes, depending whether you're doing 1 or 2 arches and the complexity of the bone anatomy, anything from 3 to 5 hours. And so when the patient wakes up, everything is closed up, the implants are placed, the gums are stitched up, and we would have sent the records off during the surgery digitally. There's no molds taken anymore. All the data is captured using digital technology, which is amazing. So I will scan during surgery, and the data goes straight to my technician who's in another state. And so by the time the patient wakes up, they've already seen what I've done, they've got the data, and they will merge the existing implant position to the design that we had prepared prior. And from there, they're able to give me a temporary printable bridge to test my design. So within a couple
So
of
this is a
hours,
3D print that you
3D print, yeah.
wow.
So I've got the design. They said, okay, this is your design. This is where you're at in terms of your implants. Then I print that. Patient wakes up. We screw it in the mouth, and we confirm our design. I never. Some dentists go straight to the final. I think no matter how good you are, you're never going to be able to nail it straight away. So a verification print is very important. Then we can really finesse it. And from there, we can fine tune. And then within a couple of days, the final teeth will come and we screw them in. We leave the printed models, printed teeth in the mouth. So the patient has something in the mouth.
That's
So
what
that
that was going to be my question. So the
yeah,
3D model actually
yeah.
acts as a
A
temporary,
temporary, yeah, a
so
super
that they don't
temporary.
have that indignity of no teeth and the
Yeah, of course.
discomfort of the trauma of that.
Yeah, yeah, and you find, and what that does is it just sets everything up beautifully. Then we literally, and all this is done under no local anesthetic. So you literally screw off, the new one comes back with all the beautiful modifications in the correct material. I always use a titanium frame inside that. So we're one of the first in the world that actually started using titanium frameworks immediately. So we deliver what we call a final solution straight away, not a temporary over 3-4 months, which some protocols do. And basically, it's a slam dunk from that point, because you've used your existing temporary as the basis and finessed it and used, again, another digital scan to make sure. I even take photos and videos in the temporary. So within that, 24 to 48 hours, what we get back, the result is spot on. And then it's easy from there. And then we let the healing process take place. They're on a soft diet for 3 months, because it takes 3 months for the bone to fuse to the titanium. So we've got to be very careful. We often give the patients Botox in the masseters so that their bite forces are reduced. So that helps. That helps in terms of reducing the patient's ability to bite really hard into something that, you're talking about patients that don't have a full set of teeth and now go to a full arch. So the brain goes, wow, and might start clenching. So that initial 3 months, the Botox in the masseter certainly helps.
Can I ask you a really, we've talked a lot about the aesthetic aspect of it, that it would be transformative. And I've spoken to people who've had significant dental work, and it changes their life. Like something that they were so embarrassed about before. They would often not smile, so people would perceive them in a strange way because they would assume that their personality was grumpy or rude. So suddenly people are responding to them in a completely different way, and it opens up their social life. A lot of people are embarrassed to date, and would rather kind of keep their life small because, again, they have so much fear or embarrassment around their smile, their mouth.
Yeah.
But I'm curious also from a perspective of longevity and health. Surely there must be a massive improvement in health once you have healthy gums, healthy teeth, a full set of teeth that can, enjoy a wide variety of food. You don't have leaching from, rotting gums into your mouth, because that's a massive cause of, and they're even linking, mouth disease to dementia and cancers and all sorts of problems. So this must be like a massive health solution.
Yeah, look, it sure is. There's two aspects here. You're removing disease, any procedure, whether it's dental or medical. If you remove something diseased from an area, it's going to allow the body to heal. So the first step is removing the diseased teeth, whether it's rotten, decayed teeth or gum diseased teeth. So the first step is to remove that. The second step is to obviously replace it with something that's functional, that works, but you also got to maintain it. So if you've got someone that's predisposed to gum disease and you're reducing that significantly by removing the diseased teeth and placing implants, you still got to be wary and obviously we discuss this with the patient. They still need to be committed to regular cleans and so forth. It doesn't mean they're bulletproof. So they can
Great
still be
point.
susceptible to peri-implant disease. And this is a really important point. Obviously, there's no sensitivity. It's much easier. We create a beautiful smile. But one of the key things in our initial discussions and consultations is the importance of maintenance. If you're not going to be maintaining your prosthesis and being committed to regular maintenance, we won't do the treatment. Because what's going to happen is you're going to waste a lot of money because you're going to have these teeth and all of a sudden develop gum disease around the implants. So that's something that is very important, not often talked about, but that's a big part of our maintenance and a big part of our initial discussions and treatment planning.
Can I ask you, is it your dentist that would discover gum disease and all the downstream health implications, or is this something that another medical expert would bring to your attention as the dentist? How does that work?
Oh, look, I mean, as dentists, we're excellent medical historians. So, when someone comes in for a checkup in our practice, there's a medical history, there's a dental history, and obviously the clinical examinations and radiographs. And we tie all of those together. So often you find, people do have medical ailments existing already, but then you see it's significantly correlated to someone with extensive gum disease. So it's quite often you see someone with gum disease and then they've had some cardiac issues
That's what
or
I was about to
susceptible.
say. So
So
it's not
yeah,
a
we do
minor
see that a
thing.
lot.
Yeah.
No, it's significant. And there's a lot of stuff we actually don't even know what correlations there are. So at this stage, the way we work is we try and eradicate the dental disease in the hope that that's going to have a significant effect on the rest of the medical aspects. But at the same time, they need to be dealing with those medical aspects. But I'm sure though the strain, the stress is taken away off the body if you've dealt with the dental issues. Not to say that it's only the dental issues, but without a doubt, if you've got chronic disease or chronic bacteria circulating within your tissues and circulating within your bloodstream, it's a known fact that there is a cardiac implication. Bacteria can lodge on the heart valves. There's been links to diabetes, and like you said, there's been links to other autoimmune disease from Alzheimer's and to other autoimmune issues. So if we can control the dental aspect, we're certainly contributing. And the other sort of correlation is if you have the ability to chew and function, and that's also going to give you the nutritional backup and power to be able to, stay healthy as well. If you're wearing full dentures, generally you've got no gum disease. There's no issues at all. But if you're not able to function, then you're going to have the consequence of being on a restricted diet. If you're going to be eating the same processed or soft foods because you can't eat raw foods, chew adequately, you're swallowing stuff because you don't have the ability to chew it. That's going to have its own effect. Now, even though the dental is not causing the issue, but the lack of dentition is. So there's many correlations. It's not just one particular thing. They all tie in many different ways. So our goal is to give you a healthy dentition, maintain it, and if we don't have a dentition, then we restore it and at the same time apply the same principle of maintaining that prosthetic via implants and bridge work. And then we throw in, we sprinkle aesthetics on the top of that, and that's a great bonus.
I always, whenever people ask me like what are some quick wins I can have in longevity and aesthetic, in the aesthetic field, I always say to them, I say, you have to have a better relationship with your dentist. I always say that. I said, because it will transform so many of your health issues. And having bright, nice, straight teeth is the quickest and the most long format aesthetic treat you can give yourself. Such a good win. And then I always say, see your hormone doctor, because most people have got all sorts of weird hormone things happening. And then I say, get your skin right, because those three things can make such a massive difference. And I'm so pleased to be sharing this information. This is why I've had you on the show twice now, is people don't understand or correlate dentistry as part of, the holy trinity of living longer, living better, being healthier, and looking and feeling their best. And it really is a hugely important pillar of that conversation. And I've had the High Smile Boys, the founders, on the show before as well. And they've they've created a category called Smile Care. And I think, again, that's so innovative and smart, because they've taken something that's kind of boring and quotidian, like brushing your teeth, and brought it to the imagination of a new generation, a younger generation, to say, your smile, your teeth, the health of your mouth, it matters. And what you've just said, it is so important. You've just said heart disease, diabetes, dementia, nutrition, bone health, longevity, all tied to what's going on in your mouth. And then people avoid going to the dentist. It's crazy.
Yeah, that's exactly right. I mean, I've worked significantly, have a significant close relationship with the High Smile Boys, and a lot of the products that we discussed as part of Smile Care was when we sat down and they said, what is your ideal wish list, in terms of products out there? And that's how, a lot of those products came about. And the beautiful thing about that is it's made, good, it's made oral health care current in terms of being hip. And if that's what it needs, then that's what it needs. Because like you said, a lot of people don't understand, and it's not their fault, because often most of the dental experiences are they ring up, they break a tooth, they call, they make an appointment, they see the dentist fixes it. There's a lot of dentists out there that do just dentistry. Our approach is more holistic, and there's a lot of great dentists out there that have that holistic approach where, they look at comprehensive treatment, they look at medical history, they look at how you can improve not only your oral wellness, but the rest of you. And that's why I work closely with my ENT. I refer more to my ENT than his GPs do. We do a 3D scan. ENT is in ear, nose, and throat.
Yes, exactly.
Yeah,
Yes.
and people say, "Oh, what do you do referring to an ENT? Like you're a dentist." I've got 1 millimeter of tissue 5 millimeters of tissue that separates my domain from his, and you're telling me, what are you doing referring? Of course, there's going to be a correlation. So many times patients have come in with toothaches, and we do our scan, and we find it's sinusitis. So if you don't have a comprehensive understanding And, you could have easily started a root canal on someone and they don't need it. And it was purely a sinus infection. So these are things, so that's just close proximity anatomically. So again, we work with, dermatologists. I do a lot of dental sort of based Botox where, using Botox to control lip muscles, asymmetries with the muscles at the bottom of the lips, high gummy smiles, masseters, where we're getting strong forces and clenching and temporalis. Again, that's a domain, that dentists really sort of see more often than most because it ties into the dentition in maintaining the dentition. So there's such overlap, but again, you have to understand the overlap in the process to be able to provide the right service. So it's not just something, unfortunately, that's something we're taught at university. Dentistry is such a vast field that, the degree is the basics of, being able to do basic dentistry. The rest is you have to do your own postgraduate studies
Specialization.
and research like anything. This is my 30th year of practice and I feel like I'm still learning. And that's how it's got to be because there's always innovation. There's techniques that you've done over the years that come up as possibly anecdotal. When the data comes out on them, you might find it's not as beneficial as you thought. So you always got to be pivoting, changing, seeing what's current and adapting. You can't just sit on, well, this is what I've been doing for 20 years and I'm going to stick with it. Dentistry or even any medicine should be considered that way. Hence the term functional medicine now is the way to go as opposed to just traditional prescriptive medicine based on, just a quick diagnosis. Functional medicine now is the way medicine's going. And I think it's the same now in dentistry. We pretty much practice functional dentistry.
Dr. Fadi, what I do want to ask you about functional medicine, and it's funny that I just had an appointment with you this week where this came in, and it was the first time actually we talked about this. You pointed out my silver fillings, and you said it's time to take these out. We need to make time to take these out, and I know that this is kind of coming into that area of functional dentistry rather than purely cosmetic because
Yeah.
you can't really see my silver fillings. But you were talking about this from a health perspective for me, weren't you?
Yeah, well, I mean, you've had those fillings for a significant period of time. I tend to change mercury fillings for two reasons. If someone comes up to me and says, I want a cosmetic improvement, I don't like the grayness coming through, I want veneers, I want white teeth. Well, some of those fillings could still be fine. But if we need to go down that path, we need to take them out. In your case, you've had them for a while, and doing the exam, you can see they're chipped, you've got cracks around them, and they need to come out. So I don't take them out for the reason of saying it's going to improve your health. I mean, there is significant data out there about old fillings leaching mercury. For me, I look at it as, well, you've already had these placed. At the time, all the leaching that you've got is taking place initially, I would say, when you first place it, and it gets to the point where it's going to plateau. The next stage is, what's it doing to your tooth? Are you getting leakage around that filling? And if you're up to that point, well, that's why we need to change it. And the key is when you do change it, that's when you generate the aerosol. So that needs to be done under rubber dam. And that's the important part because taking them out is just as important as the side effects of leaving them in there. So when you take them out, it has to be done under good vacuum, isolated with the latex, and then placing the appropriate material. So my philosophy is more so at the time that it needs it, using the right evacuation techniques and placing the right material in there.
So I'm about to turn 50. I'm about 4 months away from, and so you and I have been talking about my aesthetic and functional plan for my teeth. And I think we started chatting about this about 2 years ago, about, a plan that I'm working towards so that I've always had great teeth. I've always enjoyed having good teeth. I had, orthodontics when I was young. Typically in Australia, everyone had them at 13, 14.
Hmm.
But now I'm kind of coming into the next wave of needing orthodontics.
Yeah,
So in my experience, having that conversation with my dentist, which happens to be you, has really put that on my radar. And so we've talked about, what is the best possible outcome, what is the plan to get me there, and then what are the benefits from a health, from an aesthetic, from a tooth longevity perspective, because I plan to live for a long time, so I need the teeth to come with me.
of course. Yeah. So, that's all part of treatment planning. It's part of seeing you every year and analyzing the needs from a long-term benefit. And often, as you get older, your teeth overlap more and more. So, adult alignment or adult orthodontics is quite a common procedure now. And think of it in simplistic terms. If you've got teeth that are overlapped, two things: they're harder to clean and they don't look as nice. So if you can straighten them, and there's some great, Invisalign you mentioned, there's many different aligner systems and bracket systems out there, and whatever works in the hands of the dentist and whatever suits the patient. If you can have straight white teeth, they look better, they're easier to clean, then why wouldn't you do that? Why would you do that? It's one of the easiest things to do for a patient. And then there's obviously assessing each of the individual teeth, assessing the longevity of the existing fillings. And if you're monitoring something regularly, you can keep an eye on it until the time that you feel that, you decide that the dentist decides you need to change it, and then doing the appropriate treatment. So
Going back
that's
to,
really,
sorry.
yeah, that's really how we plan every case, every patient, and that's the way to maintain it.
Well, I'd never had a conversation like that before, and I do appreciate it, because it's made me think about my teeth in the same way that I think about exercising. It's like,
Yeah.
how fit do I want my muscular and skeletal system to be? I want to have full range of motion. I want to be strong. I want to have great bone structure. And I never thought about my teeth like that. My teeth were just service providers, in my face, but I never thought about, okay, how are we planning for this?
Mm.
So that was a really interesting shift for me.
Yeah, well, that's a good analogy, because think of it in terms of exercise and what you said. So as you age, your exercise program changes, your needs change. So you're not doing the same. Well, I know I'm not doing the same stuff I was doing 5 years ago, let alone now. So your dental program needs to change accordingly as well, and plan ahead. So like anything, you've got to plan accordingly. And one of the things that you've got to also think about, especially if you have a compromised dentition, you've got to make a call on certain things, because sometimes waiting too long, you get to the point when, you might be sick, or you might, God forbid, have the inability to have certain surgical procedures, say dentally, then all of a sudden you're stuck in a bind. So you're stuck with chronically diseased teeth because of medical issues, you can't move forward. So sometimes you've got to make a call, and I do this with patients where they put off treatment for a certain amount of time because we can. And then we have to make a call that, well, I think now it's time to pull the trigger, rather than wait another few years, because you're getting at that borderline where I don't know what's going to happen in the next 5 years, and if there's certain medical things that are going to stop you from having a general anesthetic, or compromise what we can do. So then, sometimes you've got to pull the trigger earlier on certain things so that you could be set up for the next 10 or 15. So these are things, again, your dentist has to be thinking about these things, not just, knee-jerk stuff, or just ad hoc treatment. You've got to really plan, and you can only plan if you understand what's available, have a really good innate understanding of the current dentition, and discuss, really express to the patient what your understanding of the long-term goals are, and your treatment plan, rather than wait for them to turn up on your door and say, okay, by the way, you need, top and bottom all on four. It's going to be this much, and we need to do it next week because, we've got severe infection. And the patients all these years, been coming along, having a clean, thinking everything's fine. And it happens a lot. It happens a lot, and the first question is, yeah, but I've been seeing my dentist. This is patients, I've been seeing my dentist. We've been having cleans. he said, I'm okay for now. And then, they turn up and I say, well, you've got a terminal dentition, and it's clear. We go through the scan. So this is something, it's all like anything medicine, dental, it's about communication.
Can I
And
ask
the
you
worst,
something? Is this, given that it is truly treating medical issues, like it's not like getting veneers,
yeah,
is it covered by Medicare? Do you have any kind of?
no, there's no dental covered by Medicare. I think the only component they get from Medicare for us is they get a contribution for the general anaesthetic in our theatre. That's about it. The rest is all private.
So talk
And a little bit from your health fund, yeah. But yeah, you're right. These cases are medical. A lot of people use their super, access their super. They've got funds in their super, so they're able to access that because a lot of these are terminal dentitions. They're not people
Oh,
try and
that's
access their
interesting to
super.
know.
Yeah, no, it's very important. A lot of people access their super for that because it's terminal dentition. It's chronic disease. So there's no, there's no qualm about that. We give them a thorough report analysis, and 99% of the time it's approved because that's what they're here for. I actually refuse to access super for someone's veneers because you're supposed to be doing it for a chronic issue, and requesting 12 veneers isn't a chronic issue. So that's upset a few people that have come in for that. But it is what it is. But yeah, definitely, that's something. If you can tell your followers out there that super is a significant way to be able to access that because you're doing it for medical reasons. So that's often something we see a lot of. And I can
Can I
give you
ask
the
you,
I'll give you the link.
is it possible to have just one tooth? So say, for example,
Oh,
I've
of
had an
course, yes,
accident.
yes,
So we've been
yes, yeah.
talking all day in this segment about, having your entire smile reconstructed. But if you've had an accident or if you've had tooth disease and it's just one or two teeth, can you have this same process for singular teeth?
Yeah, of course. It's totally different, but yes, of course. I mean, you could have 6 or 7 single implants in a perfectly healthy dentition. I've done many of those cases where the rest of the mouth is perfect. We've got 3 individual teeth missing on the top. We've got 2 on the bottom. They're all individual. In that process, it's not immediate. You would place the implant. You would wait 3 to 5 months for the implant to integrate, and then place the tooth on top. Um, Same with any area at the front, you might lose the front 4 teeth. Again, you would place the implants, you'd have some sort of temporary solution, and then replace the teeth. So, yeah, definitely. I mean, that's how implants started. Implants didn't start with full arch bridges and full arch implants. It started with individual. That was the first implants that were done in the 60s. They were individual implants.
Now, what kind of range of money are we talking about for the full reconstruction and also for individuals?
Individuals, you'd be looking, I mean, for our materials and our processes, you'd be looking around anything from $7,000 to $9,000 for one tooth, and for a full arch, you'd be starting. Well, I'll give you the range. It'd be from 25 to about 35, $40,000, depending on the bone level, how many implants required, what sort of implant. So that's the range. You find, there's significant value in a full arch when you can do it because you're able to restore the equivalent of 12 teeth, for possibly, $25,000 in a full arch, as opposed to the costliness of single individual implants because that's a separate implant, separate ceramic time frame, so forth.
I understand. And then also all that matching work would be significantly more time consuming, right?
Yeah, because you're doing ceramics on top of the implant stuff,
Yeah.
as opposed to the bridge where you've got it all joined and you can pick the color and the materials are different and so forth.
Now, this is the tricky question, and I'm going to ask this because,
I love tricky questions.
okay, where do you find the good dentists? Like, there's
Oh,
some,
there's one in Cross Street.
I know a guy who knows a guy. Well,
Look, I guess it is a hard question because often I think word of mouth is important. You can
Having
go
a
to all,
ball.
yeah, you can go to, all these Insta pages, you can go to all these, look at all the reviews, but you don't know. You don't really know. I've seen pages where, some of the work was ours, as a before and after.
Yeah.
So you don't, yeah, yeah, yeah. It was like we did
Well, that's what all the
reimbursement.
APRA changes are. It's like the before and afters have
Yeah,
to be verified, they
yeah.
have to be correct, they've got to be
No,
yours.
no, that doesn't happen. I mean, that doesn't happen. Like I said, we found it was actually an all on four case, and I recognise my cases even without the face. I know the teeth and I know the X-ray, and it was mine. And we actually contacted it. Oh, I didn't know. Oh, that must have been my web designer. I'm so sorry. I can't believe you did that. That's, so who would know? Patients would look at that, and go, "Wow,
But
that's
that's
a
my
great."
question, who would know? So I know that with plastic
You don't. You
surgery,
don't. You don't know.
you now are very much encouraged to go to someone like the Australian Society of Aesthetic Plastic Surgeons or look up FRACs. For cosmetic enhancement and cosmetic physicians, it's hard to find a good one.
Yeah.
And so for
It is. I
dentistry,
mean, we don't. Yeah, I mean, for the All on Four, we're part of the All on Four clinic. Yeah, it's a group of clinics around Australia that practice the All on Four protocols and our modified protocols at the highest level. That's a good starting point for this procedure. Aesthetics, I guess you just need to do your own research. You need to look at the cases. You need to look at the qualifications. Then you have to bite the bullet and make an appointment for a consult. Because I think once you have a consultation, then then you know exactly the expertise you're dealing with. You'll be able to see. You'll be able to see through, the fluff of say an Insta page, by meeting the dentist and knowing and seeing their qualifications, eyeballing them. You get an innate understanding of their knowledge, and often that's what we find. Obviously, people come through and have their consults, but once they have the consult, a lot of the feedback is it does confirm the depth of knowledge that's needed for cosmetic dentistry, especially aesthetic stuff. So
and
I
don't go
guess, yeah,
overseas for like a cheapy.
no, no, no.
Like
I mean,
seriously, I have
there are good
dissuaded
stuff.
so many
Yeah,
people.
no, we've done a lot of redos. Like I don't mind people going overseas because we get a lot of redo cases. So, but that said, but there's a lot of great dentists overseas. Don't get me wrong, but they're going overseas to the wrong places. And if they ended up going to the good guys overseas, it would be more expensive than here. So that's the difference. But where they're going and what we're seeing, especially for the implant stuff, because implant requires a period of time, not only just after the surgery, but pre and post. You can't just do a full arch case and say, see you later. I review them at 5 days, 7 days, 3 weeks, 4 weeks, 4 months, and then get a tight program for maintenance. That's how we've got high success rates. There's no way in the world that you could me fathom doing a case and 3 days later waving goodbye and never have to see them again and expect no issues. Like that, I just can't comprehend that. And that's what they're going overseas for. And they often give them extra implants unnecessarily because they're banking on, 25% of them failing. So we'll give you 10 and
Oh
a
my
fourth
God, that makes me
and
so stressed to even think
yeah,
about that.
I'd love to show you some. I'll send you some X-rays. You'll be mortified. So basically, they'll stick, 10 implants in. That gets the patients excited because they're going, "Hey, I'm getting 10 implants. You were going to put 4 in my mouth, and you were going to charge me 5 times more. I'm getting value." And then a year later, live a laugh. But a year later, 4 of them have got implantitis and come out. Like it's scary. So yeah, it is. And you're better off if you're going to be spending that much money, it's going to cost you more, go back and forth, airfare every time, and you're still going to be stuck in the same position. You're better off finding someone, working out a way to achieve it, and know you've got your dentist here for as long as you need them to, and warranted, and a phone call away if there's any issues. Why wouldn't you do that? You're talking about something that's bolted into
Well,
your
I know
head.
that I've phoned you and found you for nothing, and you've been available. So, when it's in your mouth, it feels like the whole world is looking at it. So I can only imagine that if I had something as important as a full bridge put in, that I would want
Yeah,
access to my dentist if anything
Instantly.
should go wrong. I totally get it. Dr. Fadi, that was the best conversation. I learned so much from you, and
Me
I
too.
am evangelical about teeth as part of the whole ageless conversation. And it gives me such great pleasure to host you on the show.
Thank you. Always a pleasure.
You know what I always say to myself, like my beauty trust, like that I have the best people in the business looking after me, and I love to share your expertise and your incredible amount of knowledge with the listeners and the viewers. And I want to thank you so much for coming back on the show. It's been a while, but this one was such a great conversation. Thank you so much.
Sure was. Great. Thanks for having me. And, you know,
I'll see you
always
again.
available. Look
Yeah, we're
forward to
gonna.
it.
I'm sure there's more to come. Thank you.
Take care.